Welcome to the Architecture of Healing, the podcast where healthcare strategy, design, and operations come together to shape environments that support care delivery and healing. I'm your host, Chase Miller. Today's guest is Erica Parker, a human factors leader helping guide innovation and AI implementation at MD Anderson. She sits at the intersection of design, safety, and emerging technology, where decisions carry real impact for patients, clinicians, and operations. In this conversation, we break down what human factors actually means in healthcare, how AI and automation can unintentionally create new risks, and why education, governance, and workflow readiness matter more than shiny tools. We also explore why many innovative solutions fail to scale and how constraint-driven, incremental innovation often delivers the greatest impact. If you're thinking about technology and environments that truly support people, not just systems, this episode is for you. Let's get into it. Welcome, Erica. It's great to have you on the show today.
Hey, Chase, how's it going? I'm glad to be here.
I'd love to, as we start things off, just talk a little bit about you. You have a very interesting trajectory of your career, and I'm really interested to unpack that a little bit, coming from a design background in an architecture firm and moving towards this human factors role in the technology realm with MD Anderson. So could you share a little bit about how you got from the design space to the technology space and what that looked like?
Yeah, definitely. I would say that my design career has been all-encompassing and it's really shifted in the best way possible since practicing architecture in New York, where I started at Perkins Eastman Architects and specifically working in their Studio 6 in their healthcare department and working as a medical planner, and then switching after 5 years over to the client side. And so I would say that's not as common, or it's probably more common now. But back then, I actually went through a few classes before switching into tech. So I went through a training at Brain Station is the name of it. It's out of Manhattan, and it was a UX UI course that helped me just get the foundational learnings of product design. And from there, I decided to build a portfolio. But I think the real catalyst for me was participating in the Healthcare Design Magazine Challenge. And they had this competition in 2020 when we were all remote called Breaking Through. And I think it was either the first time they had done the competition or the second time. And I participated virtually, and it was a blast. And I realized, wow, I can be a part of innovation in so many ways. And so that was really the program or the opportunity that set me in the direction of innovation. And then from there, I was like, wait a second, if I really want to pursue this as a career, I need to have the portfolio that supports that work. I also have to have experience as well. And so I did my work at Brain Station. I finished my credentials and built a portfolio. And I was doing it while I was also practicing architecture. And this role magically came up at Memorial Sloan Kettering Cancer Center. And I was like, oh, I'm going to go for it. And it was a senior product design role. And they accepted me not for the senior product design role position, but they said, you can be a product designer in our digits department. And at the time, they were hiring for a really unique role for an incubation team. That entire experience really shaped my design career, a lot of who I am today, and it helped just set the trajectory for strategy, innovation, and technology development.
I want to go back to the Breaking Through competition. I remember that year of the competition, which those ideas were so interesting. Can you share a little bit about what your idea was? And if I remember correctly, it had something to do with sound. Is that right?
Yeah, I actually participated twice. So once in 2020 and then again in 2022 with my new company with MSK. And it was so fun because I became a finalist both times. And there were just these creative concept design ideas. The first one was around an interactive spatial experience for users who had sensory issues. So I would say I told the story through the lens of this little girl named Anna, and the name of the project was Gizmo. And we had this healthcare journey that was so unique because it started at the front door. And so the concept was around like, what if instead of you needing a cane or a wheelchair or an assistant to help you get through the hospital, what if the building reacted to you? And that was like the entire concept was like moving walls. And rather than having a handrail, what if a handrail appeared for you? And it was just like this really crazy concept told through the lens of a young girl who had vision challenges as well as auditory challenges and relied heavily on her mother. What if we could give that autonomy back to the user or back to the patient? How could we help them feel free in a healthcare environment using um, technology that doesn't exist yet, which was the best part of the competition? If there's no budget, no limitations, what would you design? What would you invent? And it was the most awesome project just because it was through the lens of a little girl who, when she leaves the hospital or leaves the care environment, all of a sudden, like, she has to rely on a caregiver in order to live. The second one was in 2022, and we called that project Aroma. So lots of acronyms, but we called that project Aroma. And at the time, my coworker and I, Pulkit, he was researching e-nose technology, which is scent technology. So the ability to smell particles in the air and identify what those are to eliminate HAI, so healthcare acquired infections. And we were just doing all this e-nose technology desk research. And I was like, hey, let's participate in this competition. I did it before. Let's do it again. And let's make a building that can smell. And it was the craziest concept. That project we actually set in Louisiana's Cancer Alley. So there's like an actual geographic region that is prone to cancer. And there's a lot of factories over there, and it's really in these areas that affect marginalized people. And so there was also this layer to it, which was really interesting. And rather than actually creating an entire structure, so like one building like we did in 2020, this concept was really on the idea around what if we do something systemic and something that's sustainable and ecosystem driven. So like we could create these apparatuses that could function like these tents, and they would encourage third spaces so they could be used in parks as areas of respite or just enjoyment sculpturally. But the whole idea was around these tent, or what we call the yurt, was the inspiration of the precedent behind the design of these advanced yurts that could be placed anywhere and help detect harmful pathogens. And so mostly we were targeting cancerous pathogens that could lead to poor health outcomes. And then I think another part of that design layer was having a similar system embedded in the homes of everyone. So again, a much smaller design, but more systemically connected. And the idea was around like having the same kind of e-nose technology in your home to smell similar pathogens that can cause harm. And a lot of people don't know that having your candles lit all day long, your Lysol spraying, all of those particles in the air can be harmful if, it was very interesting where we looked from two different lenses. One was what's the fabric of a city like, and how can we detect and track smells in the air from just a large scale place. But then also there was the more individual perspective, which was really interesting. And that was what happens in a home and how can we help protect from harmful chemicals, pathogens.
Incredible.
So it was two different projects, but really set the tone for my love of innovation and all the things I do now, which is really fun.
Yeah, so that really codified in you like this idea to move into this innovative technology world, right? So thinking about the breaking through competition, what comes after that? I mean, you had these cool ideas. Is there any momentum around those ideas, or did that just kind of births this thing in you that carried you into this new chapter of your career?
So the projects didn't go anywhere from an actual implementation perspective, but they did set the tone for just creative thinking. I was really lucky to have joined the team at MSK and to have been able to think freely for 2 years about what the future of healthcare technology looks like. And not only be able to just think in a creative capacity, but also be able to work with data scientists, engineers, and be able to design something meaningful. It was very interesting to work with that group because we didn't focus so much on the implementation half of the human-centered process. We were looking more so in that design and test phase, like what's feasible, what can be built, what can we own? And the other interesting aspect of that role was like what can be patented and commercialized. And so we looked at hacking all kinds of software from Unreal Engine to Unity, building things in VR and 3D, and big portion of the project I worked on were actually centered around pain management, motivation, distraction from pain, from those kinds of ambulatory treatments. So when you're coming in to get your infusions or you have to get some kind of spinal tap, how can we distract patients from the pain that they're experiencing? And so rather than looking end to end at a patient journey, I was focusing on these singular moments in time where people felt discomfort or they felt like laying in bed and not getting up and moving around, or children can't touch toys because of compromised immune systems. How can we engage them in play in a way that's, again, similar to the breaking through concepts? How can we grant our users autonomy, comfort? And so that was something that was really special and very unique for an oncology hospital, one, but to just have the time to be a designer and be creative and think of concepts from scratch and then actually build and test them was incredibly special. It almost felt like a startup within a hospital.
Yeah. I mean, it's not often that you get to think that way without, you know, constraints like budget and what's real and what can happen. And I'm actually thinking about that. How do you disassociate what's possible with what's reality? Thinking about your work even now in human factors, I would imagine you have to do a lot of that of thinking about what's possible versus what's reality. Because as I think about, new ideas, it's based in what I've seen. And you kind of take that preconceived notion, like you have to get that out of your head to think about how to innovate and think differently. Is that something you regularly encounter?
I would say that so MSK was like Disneyland for me, and I told a lot of my friends that. I was like, "This is not normal. Usually you have a budget, ROI is attached, impact is attached. There's a very defined use case that's sitting alongside whatever technology you're implementing." Whereas in my current role as a human factors principal at MD Anderson, the team that I'm on is very unique also in that we kind of balance that conceptual design portion, but we heavily focus on the implementation. So things are very tied to impact, return on investment, budgets, and those are the elements that shape how fast, how slow technology vendors and what can actually be brought to fruition. And so in this role, I think I've gotten a lot of experience grounded in the art of what is possible through a very unique lens of innovation. And so what my team does is we look at innovation from a problem solving perspective, from an educational perspective, from a service design perspective, and not necessarily the technology development aspect that I was working in earlier. And so, to answer your question, there are a lot more constraints, but good constraints that help shape projects and bring about change. We talk about innovation from these four quadrants of adjacent innovation, incremental innovation, disruptive innovation, and radical. And where my team sits right now is really in that adjacent and incremental part of the quadrant. So there's like these four boxes. And what's great about that is that our team is looking at challenges that exist, and we either try to solve problems incrementally, or we might update a system, and those changes might be small, but they make a difference in workflows and they actually impact the day to day. So when I'm actually working on a project, it's making a difference in that everyday patient experience versus before I was working on projects that were radical or disruptive, or if we actually commercialized a product, it could change how healthcare and pain management is executed. And that was so disruptive, though, that it stayed in this one lane of never getting implemented, never scaling, because it has to go through so many approvals and you have to have the budget to actually um, make that solution possible. And it just,
Yeah.
it had to go through so many hoops versus what I do today. It's a little bit smaller in terms of an innovation impact scale. It's not small in terms of scale, but it's not as radical or not as disruptive. Like we're not
Sure.
replacing Epic, for example.
Yeah,
We're
yeah, yeah.
making
Well,
changes,
and
to Epic, right?
and
So
to that point, I mean, I always find innovation really seems to shine in places where you have the most constraints and you're painted into a corner. And you have to find a unique or creative way to get out of that and solve that problem. And so it's kind of the polar opposites, right? No constraints versus infinite constraints. And how do you get out of there? you know? So going back to this term human factors, and I feel like I kind of know what that is, but I also have no idea. Can you describe what human factors is and maybe what that looks like on a day-to-day basis for you?
yeah, I would say that my role is actually a hybrid between a human centered designer and a human factors practitioner. And so I think when people hear human factors from a traditional lens, they automatically go to engineering and they think about NASA, they think about airlines and how there are human factors practitioners that are looking at safety from the lens of like any kind of factor that can limit human ability. So you're looking at the engines, you're looking at the lights, like how are things actually built in the real environment? How are people using these interfaces? And they're looking at it from a very unique safety lens. And we also have human factors practitioners at MD Anderson who are doing the same thing. They are creating checklists and doing a complete patient safety analysis. They're doing root cause analysis and they are going through entire lists, looking at either what went wrong or what could go wrong. For me, my role is very unique in that I was the first human factors designer to be added to the innovation team. And my role and expectation was to help shape the definition. So this is actually really funny. But essentially, my job is to understand in the same capacity as other fields, understand what those human limitations are in relation to human computer interaction, physical tools and objects that might be used, and understand where potential issues could arise. So, for example, and more specifically, my job was geared towards AI. So more of the digital side of human factors, not so much the physical side. But there's the ergonomic side of the role. How long is someone sitting at their desk for? Are they slouching? Are they in a comfortable chair? Are they putting their hands up a certain height above the table that's making their carpal tunnel catch on fire? Those are very specific ergonomic issues that can be resolved through a human factors assessment. For digital tools, it's a little bit more difficult because everyone's on an interface of some kind. We're on the computer now, we're looking at each other, we're typing things all the time. And where can things go wrong from an errors perspective? What kind of things can we uncover, especially when it comes to healthcare, where in a high reliability organization, you're looking for safety everywhere. So if a patient isn't able to submit a form before surgery because the button's too small and they can't see it, that's an issue. That means data is not getting transferred into our organization. We can't prep them for surgery, and there's this huge disconnect. And that's a lower level risk issue. I think like more large kinds of human factors engagements that we're looking at are like, what is the future of AI if I have this new system that can scan 1,000 images a day and it can look at diagnostic images, read everyone, and spit out a result? That sounds great in theory. That tool sounds amazing. I'm sure that startup is making millions of dollars. However, what that's doing now is it's putting pressure on our workforce to review 1,000 images a day. And that's just not what they're doing currently. And do they have the cognitive capacity to even handle that amount of load? So just because a technology can do something doesn't necessarily mean that's the right direction to go. And so my job is to assess risk, errors, any kind of problems such as that with AI. And more recently, we've been looking at robotics. So the same thing. We want to operationalize everything from your welcome experience into the hospital to how we clean up waste and clean the floors. Great. So I'll put 5 robots into this welcome experience, and now you're no longer greeted by humans. You're tripping over robots, and there's no human connection or interaction anymore. So we've taken away that entire experience as a replacement for efficiency. There's a gap there in terms of design decisions that have to be made. And so that's really where this human factors role comes in. It's looking at a lot of different inventions, a lot of different technologies, and trying to understand where the gaps are with humans and how we can fill those gaps efficiently. It's not always assessing technology. Sometimes the answer is there's not enough people, which has come up many times where I could implement a technology that can summarize and detect and read all of this information, but at the end of the day, you have to have a human in the loop who needs to review all that information. And if I don't have enough people on my staff to review that information, then this technology really isn't a force multiplier. From an operational standpoint, you need more people. So that's really what ends up happening. And it gets really interesting just around what are the actual unmet needs of our users and what kinds of things can we find in our systems that require a little bit more support or a better strategy or more employees or more education. Actually, something that was very interesting more recently was uh, trying to rebuild or redesign a experience for our researchers. And what we found was that it wasn't necessarily a product issue. It was actually an education issue. So if people don't understand how to access the data and use the data, then the product is moot. So it doesn't matter how nice of a product you design if people don't understand the data sets and how the data is being configured in order to search up the right information and look at the right data sets in order to create the queries that you want, then it makes no difference what technology you actually implement because you have an educational gap.
It's the technology. It needs to be intuitive. The process needs to be intuitive, so it's simple and understandable, and has a low barrier to adoption, if you will. I want to go back to something you said, and I absolutely love this. Just because you can doesn't mean you should. And there are so many cool gizmos and gadgets out there, and AI is doing this, that, and the other, and we're solving problems that aren't even problems, and we're thinking about these really cool ideas, which is great, but it doesn't necessarily mean we should. And I've been in a number of healthcare facilities where we have these digital whiteboards and we have them, but there's no support for them, or the infrastructure doesn't exist, and there's no education around how to use them, and they just sit there, and the staff buy a marker board and put it up next to it and just use a marker board. To your point about around education, these ideas are fantastic. They're going to lead to improved efficiencies, better patient and staff experience if they're implemented appropriately, correctly, and there is truly a problem they are resolving or solving, right?
Yeah, I would definitely 100% agree with that. And a huge part of what I do now and what our team does as a business unit and design unit is we double check with both the technology vendors that we're engaging with as well as our workforce. Sometimes the technology is so advanced that our teams just aren't ready for it. And that's a reality of innovation is that there aren't enough people, the infrastructure's too old, there's no way to integrate the technology. There's an education gap, they don't know how to use the technology. So are our teams fundamentally ready for this technology? And on the other side of that, is the technology ready for us? So sometimes we work with startups that are piloting and they're trying to improve their product in some kind of way. And so it's this chicken or the egg where you're just trying to figure out, is this the right match? And if not, how do we quickly assess and then move on? And if it's a unique opportunity where a technology or company is in its early stages and there's the opportunity for us to pilot and create something and co-develop together, sometimes we want to take that opportunity because it leads to a better product experience for the startup and then a unique first look at something for us where we can say we did this first, we experimented with it, we understand the technology. And on the other side of that, if things aren't a right fit, it's our job to talk to our workforce and our clinical teams, our researchers, and understand where are you guys at? What do you need? And how can we best help solve this problem? So it really just starts with a conversation. And I think that's where I like to highly emphasize human centered design because that's what it is. It starts with a conversation, understanding those user needs, and the human factors layer that comes in is okay, great. We understand what your wants, your needs, your pain points are. And now let's watch and observe how you interact with those systems, those products, that environment. And how can we really optimize that interaction? How can we improve your safety, your performance, and your satisfaction so they go hand in hand together?
That makes me think of I was at a conference last week, and one of the keynote speakers noted that the healthcare industry single handedly keeps the fax machine industry alive.
Yeah.
And it's hysterical because we're talking about all of this advanced technology and AI, yet we're still sending faxes back and forth. And it's kind of this double-edged sword where we're living in this fax world, but we're also thinking this next thing is going to revolutionize the industry. And how do we bridge the gap there? And I think you're hitting the nail on the head. It's around education, adoption, and support. And how do we move that needle forward on this gargantuan ship of an industry that turns very, very slowly? So going maybe more specifically into your work at MD Anderson, I know a lot of the work that you're doing you may not be able to share about directly, but are there any cool ideas, anything that you guys are exploring that is worth noting as it kind of relates to improved efficiency operations and the space of healthcare organizations?
Right now, I'm currently co-leading the operational intelligence portfolio with one of my colleagues, and that's been a really unique experience because, like you mentioned earlier, it's all about AI. And just even thinking about the fax machine, our job right now is to look at those kinds of operational inefficiencies or where the biggest pain points are, and to see can AI be a force multiplier in that operational workflow, and can we make a difference using this technology? So we have a lot of cool things in the pipeline. More recently, I think a big part of the work has actually been around governance and intake of AI as opposed to one singular operational workflow. There's 1,000 use cases where AI could be applied and tested and proven. I think what's really magical about MD Anderson is that we're in the process of what I believe is creating an ecosystem of success, which means that we have people at all different levels, not just institutionally from a UT system, right? There's many different institutions within the UT bubble and just trying to understand how can we monitor, how can we manage and scale AI. It's really a beautiful thing because it's happening from this larger system model. It's happening internally with how we at AI tools, vendors, how we co-develop and create our own solutions in-house. And then how do we educate, which is where my team and other parts of the institution have come together to create educational materials around how AI can be used. From what I've been hearing from other organizations is what tool are you using and how did you implement it? What was the ROI? What was the results of getting this new scanner or this new dictation tool? And I feel like a lot of time and effort has been spent around if we can actually manage the way these tools are coming in, and if we can look at what's actually being asked, what is the actual business value and the impact of these tools. And if we do it on a systems level, so if it works for us, then you can go ahead and implement it and see if it works for you. I think that's really a beautiful thing that I don't know if other healthcare institutions are even thinking about. Because right now, for me to go to a Cedar Sinai and say, what are you implementing and how does it work? That's unusual. I think it does happen through different consultancies, but rather than focusing on one singular solution or looking at what the highest priority AI to deploy is, we're looking at, okay, if we create a really well functioning system of evaluation and intake and governance, then it doesn't matter what tool comes down the pipeline because we'll have the resources, we'll have the infrastructure to support it, and we'll have the right people reviewing and evaluating and making sure that it can actually scale. I don't know if that directly answers like what's like what.
Oh,
Okay.
that's fantastic. That's fantastic because it really outlines, this infrastructure of deploying new ideas.
Yeah.
So when you're evaluating these things, what's the criteria? What are you evaluating them against?
I can't give that away, but
Oh, the secret sauce.
this us, we have a wonderful AI lifecycle and management leader who's flushed out that criteria and we've evolved it over time. And it is a long list, but it's important to get all that data up front so that way we can ensure that it goes through the proper intake process and that it gets evaluated by the right executive leaders, whether they're clinical research or in digital. It just depends, but that criteria has been evolving. It actually hasn't stayed the same since I've looked at it. It's changed a lot. And I think it's going to be a huge value add for the organization because AI is not going away. I think
Yeah.
people are asking for these tools. There's an expectation of us to have it. And what we're doing now is making sure you can get it in a timely manner. So when a request goes in, then you can deploy or implement that solution with ease, which again, healthcare traditionally takes forever to do anything. And so to have this kind of current system that's being built, I think is going to be a game changer for the next 5 to 10 years.
That really does set a stage for true innovation by creating the guardrails from which you can build off of. That's amazing. So being on the front edge of all of this AI advancement, are you seeing anything that is just completely overhyped as far as tech and integration? We're hearing a lot of different things, and is there something that's, yeah, this is awesome, but in reality it's just okay?
Mm. I would say that there's always a business case behind every ask, and it's valid to some degree. So if someone's experiencing a pain point and they really want a solution for it, there's probably a reason why. I wouldn't necessarily say overhyped from a solution standpoint, but I would say there are certain companies that will take something that is overhyped and try to create a solution in order to stay in the market or retain some of that market value. Maybe in consumer industries, I can name several things that don't matter that everyone's excited about. But from a healthcare standpoint, there usually is a reason why someone wants to do something and then everyone kind of bandwagons on because it's needed. I think one of the things that's been really big right now is ambient listening. So that's been like a huge technology that I haven't seen one organization that hasn't tried to do something similar, but everyone's in the market for ambient listening. Um, and it's a needed thing.
Yeah,
And
and even too like overhyped in the sense that yes, we got to do this. This is awesome, but there's 5 million things that have to happen to make that even possible. As you're discovering as you build this kind of framework of governance.
yeah, I guess from that perspective, then the one thing that's come about this year has been AI agents, and everyone's like, I need an agent. I need an agent to do this. And then you see the news of agents are taking over everyone's jobs, and that's been the headliner of everything, which is valid. But what I'm seeing is that people want an AI agent, but then they don't know what it is. Do you even know what you're asking for, even though you're asking
Yeah.
for it? But it is super helpful, and I think it could do a lot of things. I just don't think people are fully educated on the capabilities of an agent or what it can do from a autonomous standpoint and why it's so important to understand the fundamentals of that before asking for it.
Yeah, that's really funny that you say that. I've been thinking about an AI agent in terms of automating my own personal workflows. And the best way I've heard it described as it's essentially think about having your own intern that can help you. But you have to teach that intern and train that intern and help them figure out how to do everything. So it's great, except you got to figure out the best way to deploy it and use it and all of those things. I want to close with a big question, a big thinking question, but if it were up to you to redesign or change one aspect of the healthcare system, what would that be?
Oh man, that is a great question. I would say if I had to redesign one aspect of a healthcare system, I still go back to my first competition project, and it's actually a physical, like environmental change. Because there's so many different digital aspects of healthcare, from my chart to looking at your results on your phone or talking to somebody through chat. But it comes down to the space that you're physically in. And I think not just like a waiting room redesign, not a patient inpatient room or outpatient space. It's just the entire journey from when you enter to when you exit. How do you experience your time? And that is something that I think, if in an ideal world, if it could be different, I would want some kind of interaction at every point that was personalized. And I think that's special because every human has different needs, different perspectives, and to know that you can go one place and it understands you is something really special, whether it's the language of a sign, just because that's your first language, or having it say, hello, welcome to so and so, and we're glad to have you here. We knew you were coming. Like those kinds of experiences, whether it comes from a human or a digital kiosk or a piece of technology, I think when we hit that level of innovation, it's going to change everything. And I don't mean just from a healthcare standpoint, also a consumer lens too. You open up different revenue channels, you open up different connection points. If you can imagine being an inpatient in a room and the walls say, hello, Erica, we know that you're here. Would you like to send a message to room 205 to your friend that's also just got out of surgery and needs help? How do we use technology to get closer to other humans? Is where
Yeah.
I go to. I don't want to have to see technology per se or like know it's there, but I want to be able to use it to get closer to other humans.
It's almost like an AI built environment where it anticipates your needs before you get there and arrive and it's the true universal design on steroids, as you walk through a space. To your point before, a handrail comes out of nowhere if it senses you're
Yeah.
about to fall. It it brings it to the right height if you're, 10 years old.
Right.
It knows who you are and responds to you as an individual. That's so interesting.
And I think
I,
it lays the groundwork for better conversations. If you know you don't have to look at your phone when you enter in a building to check to see where you need to go, then you can actually have a conversation with a navigator and walk with them longer and talk with them longer. Or the same thing with your doctor. If all of your results are just on the wall, you don't actually have to check your phone every 5 minutes to see when a lab is coming through. Hey, how about we talk and walk about my results? It's, yeah, using technology in a different way. I think it's going to be interesting.
so let's jump into our lightning round. We'll just hit these real quick here as we wrap up. So, what is one of your favorite healing spaces?
Oh man, probably outside. I don't know if that is a healing space because it's not really enclosed, but I would say that when you're going on walks, when you're in a park, when you're surrounded by nature and your feet are touching the ground, that is more healing than any kind of manufactured design can
Absolutely.
be. So yeah, that's
Yeah.
one.
What inspires you outside of work?
Outside of work, it's definitely art and music. I love any kind of artist or creative engagement. So I follow Pharrell Williams wherever he is in the world, whatever he's doing. I also love to look at venture capital because that's where innovation starts. What startups are creating things that I can test out and see what's working, what's not working. So a lot of my inspiration actually comes from VCs. And I also am heavily inspired by what's going wrong in the world. If that makes sense, it's crazy. But if you look at like private equity firms and how they, tear things up and down, that also inspires me to look at how we invest in businesses and where these startups can go from a longevity.
Yeah,
So,
I mean, you kind of learn more from what went wrong than you do from what went right.
and I think all of everything is powered by the finance industry. So if you look at where people are spending money, it actually can tell you a lot about what's going to happen next in healthcare.
What is a book that has changed the way you think?
I'm still in the middle of it, but my friend recommended The Creative Act by Rick Rubin. I think this is a really interesting book because it's all about how to be creative, and that's definitely been the past couple of months for me. Being creative isn't easy. As many people think all I have to do is imagine something, which is true, yes, but unlocking that mindset can be really difficult. And so Rick Rubin takes this different approach to everyone's creative. It's just about how you unlock that potential and how you look at your thoughts, your feelings, data, and interpret that information to come up with something that's unique, that's interesting, and meaningful.
And last question, finish this sentence. The future of healthcare is blank.
The future of healthcare is data. I know it's not design, but it's true. The future of healthcare is data. And I said this a couple years ago, but I can't wait for us to get to a point where we own our data. I don't think people realize how much they're giving away when they sign up for emails, when they are opening up an anything, when they're opening up things on their phone, when they're answering surveys and questions. And right now, these healthcare institutions, they own your data. You get those lab
Yeah.
results and things like that. That is research that you sign off on the minute you walk through the door in most organizations. And you do have a right to that data and how it gets shared. But I feel like the future, it's going to reverse. And that's my prediction, is just that eventually patients, users, they're all going to have more ownership of their data. They're going to want transparency around that data. And they're going to want to know what you're doing with it behind the scenes. That's going to just evolutionize everything in healthcare and how we approach our patients. And it's going to
Yeah.
be really interesting.
That's huge. And I know you and I have talked about this in the past where how awesome would that be if you own your own medical records? You show
Right.
up to whatever health system or hospital you want, say, here's my, QR code and Here's all my records. They're mine. They're not in your Epic or your Cerner or whatever. They're mine.
Yeah.
And rather than having to go to different places and fill out the same form 6 times, you've got the form, you've got your labs, you've got your scans right here
Yeah.
on your phone. That is so true. I love that. That is a great comment.
Awesome.
Well, that brings us to the end. I can't believe it. This has been such a fun conversation. Thank you, Erica, for joining us today. This has been great. I look forward to having you back in the future and continuing to see what you're up to and what new and exciting things you've been doing. So thank you.
Yeah, thanks, Chase. This has been super fun.
Thanks for joining us on the Architecture of Healing. I hope today's conversation brought you fresh insight and inspiration. If you found this episode valuable, make sure to subscribe, download, and give us a review. Want to learn more? Keep the conversation going and head on over to thearchitectureofhealing.com. We've got more great conversations on the way, but until then, keep shaping the future of care through thoughtful strategy, smart operations, and purposeful design.